One. What is up, Facebook world? It is Gregori Lukas. Good morning from the East Coast. I am joined today by one of my favorite people, Dr. Kendra Pope, who is a board-certified veterinary oncologist who also practices oncology in a totally different way than the average conventional practitioner. She uses a lot of integrative modalities to really help ignite a healing response from within animals, and animals that are suffering and going through a terrible time in their lives where they really need to reach for help. And Dr. Kendra Pope is there to help them. Hello, Dr. Pope. It's so nice to
meet you. I know, I'm excited. Hi.
Hey. So what is an integrative oncologist? How is that different from just a regular veterinarian?
Yeah, so the word integrative, which I'm sure, Gregori, you've heard a lot and the community has heard a lot, is really a term that was coined by the professional community to be more acceptable. Probably most owners know the word holistic that's much more common and well used. But the word integrative was actually created by the professional community to differentiate complementary and alternative medicine, because it's not a complement, it's not an alternative, it's truly integrated with conventional care. And so it's meant to be verbiage that helps you to understand that it's one of the many tools in the toolbox. It's not a tool separate outside of the toolbox. There's this really beautiful description of what integrative oncology is that was created by a human integrative oncologist, Dr. Abrams, and I love it. So when you think of cancer, it's the weed. It's the weed that's growing out of the garden. And conventional cancer treatment is the pesticides, the poisons that you pour on the weed to kill it. But integrative oncology, what we do is we do the terrain. We're the gardeners. We're the ones working on the soil. So we're making that soil as inhospitable for the weed, but as perfect and wonderful and great for the earth for us. And so my job is to focus on the terrain and the soil, while conventional oncology treats the weed with the poison.
I'm in love.
Isn't it the most beautiful analogy that you've ever heard? I love it so much.
It absolutely is. And especially when a pet owner comes to you, I'm sure they're very fearful. So to hear something like that is just so encouraging and strong. And it's just a really, really awesome thing to tell everyone right now. So thank you for that description. When an animal comes to you, I know cancer there's so many forms. The disease that the animal is experiencing. Is every treatment that you can offer appropriate for every form of cancer? Like, I know acupuncture right now is being used for in testing for like lymphoma. Would acupuncture be used for a different form of cancer?
So that's a good question. And I think that's something that's what's so special about holistic and integrative medicine that really differentiates it from Western medicine, and what can make it really difficult, for my colleagues to understand why I do what I do, or how to use the modalities we use, and conventional doctors training in holistic modalities, why it can be so confusing. And the same for clients, is that when you're using these tools like acupuncture, herbs, nutrition, nutrient therapy, all that stuff, you're not treating lymphoma or sarcoma or carcinoma. You're treating Fluffy or, Jake or whatever patient it is. Because although the cancer is treated secondarily through treating the patient, it's the patient's innate imbalances, metabolic dysfunction, genetic dysfunction that's led to that cancer. And because we're working on the soil, not the weed, it doesn't matter what the weed is. Sometimes there are certain mushrooms, for example, or herbs, for example, that have really nice research against cell lines or in clinical trials for certain cancers, and we will reach for them then. But most of the time, two cancer patients with the same conventional diagnosis will be on different regimens. Whereas in conventional oncology, if you have hemangio, you have hemangio, you have hemangio, and you're given the same protocol. But integrative oncology is about treating the patient, not the disease.
Amazing. So, and I love that you look at every case differently too. Because we can't box everything into one thing, because then it's just not the right treatment and protocol.
It's truly personalized medicine. And it's funny because holistic practitioners have been doing this forever. We know that you treat the patient, not the disease. But now in oncology world, it's all about personalized medicine and targeted therapy and, checking gene mutations and picking personalized drugs that work for the cancers. Whereas we've been doing that all along. So it's just ironic to me.
For an animal that might be having really bad side effects from traditional chemotherapy treatment, are there things that you can do for an animal that might be just totally withdrawn because of the treatment that they're going through right now?
Yeah, so that's actually, when I talk to owners, I would say about half of my clients choose to pursue conventional oncology treatment. So they are going through the surgery, radiation, chemo route, and the other half choose to forgo it. So a lot of my patients, we are mitigating and trying to minimize the side effects of conventional treatment. And this is actually where the most research is done on the human side, because obviously, if you're a person diagnosed with cancer, you're very much pushed to do conventional treatment. And so a lot of what integrative medicine on human patients is supporting minimizing side effects. So things like acupuncture you mentioned, for example, there's actually tons of data on the human side that show that for chemotherapy in particular, it helps to decrease nausea, vomiting, diarrhea. It's been shown with women undergoing hormone therapy with breast cancer. It helps to mitigate the hot flashes and the joint pain that happen from their treatment. Xerostomia or dry mouth from radiation therapy. There's even evidence that shows it helps to increase the white blood cell counts that are decreased from chemo. So acupuncture absolutely has a ton of quality of life supportive care measurements. So we've used that a lot. I've had a lot of patients that they're pretty good. Their quality of life isn't bad, but their owners are like, Kendra, what else can we add in with their chemo? And the owners just really feel like they do so much better if we do chemo the day of or the day before their acupuncture the day of or the day before their chemo. And then the herbs, and the food, which they're a given for everybody. So changing the diet, there's really, really interesting data on the human side about intermittent fasting and ketogenic diets and what it does for basically the normal cell's tolerance to the toxins and the bombardment of the chemotherapy. So there's tons of evidence on the human side that show even just if you fast 14 hours before chemotherapy and 48 hours after chemotherapy, people who are getting 3-4 times the dose of chemos we give to animals are not experiencing side effects. So that's super cool. And then the herbs, herbs that a lot of us know about, things like ginseng and astragalus and the medicinal mushrooms. Time and time again, they're used in the Chinese herbal formulas to mitigate these side effects. It's called Fu Zeng Pai Bun therapy. And so we use them all the time. Absolutely.
Yeah, when I was sitting in your lecture up in Albany a few months ago, I was just like, oh my goodness, like there's so many like herbs and just things that you can utilize that you have now put in your toolbox that you've had success with. Yeah, and that's so uplifting and positive, because again, when you see an animal suffering, like I just said, from these traditional treatments, it's like, give them that extra boost, give them that extra comfort. Yeah, these products that are so easily accessible with an integrative oncologist, of course. But
and I think that the other piece of it that's really healing too is that, probably it's funny because when I talk to human integrative oncologists, a lot of them won't treat children because they don't like having to deal with the parents, because as caregivers, they're so out of their minds. And it's funny because I would be too. Could you imagine? It's horrifying. And so, but I think that probably veterinary oncologists are most similar to pediatric oncologists, because we can't talk to our patients, with an honest conversation to ask them what their experience is. We're working through the caregiver to ask them what they think is happening. And the caregivers experience a lot of suffering because they're carrying the burden. They're the ones that feel helpless and hopeless. And so a lot of times cooking nutritious food, giving them herbs, making them bone broths, taking them to their acupuncture treatments is helping them to feel like they're playing an active role in caring for them and helping them with their treatment. And I think that in itself is very healing too.
For sure.
Yeah.
Do you, and this is one of my favorite questions to talk about, obviously nutrition. Yeah. You specifically have to tailor diets so perfectly for certain cases. Do you find that really easy to do personally, or is that something that you like really have to take a step back and really examine every herb that you're giving already? And how do you tailor a diet for an animal?
Yeah, so for the cancer patients, not always, but a lot of times they're seniors. And so they often have a lot of other comorbidities or other problems, whether it be liver dysfunction, kidney dysfunction, cardiovascular disease. So a lot of times, and all nutritionists will tell you this too, diets are not one size fits all. They're also tailored for the patient. And so that's the first thing that you have to take into consideration is, are there any dietary restrictions outside of the cancer diagnosis, diabetes, for example, other things that you need to know about when you're choosing foods that would be appropriate. The other thing that you have to be really honest about, and the client needs to be really honest with you about, is what's realistic for them. Because I have clients that come in that they are retired, they are living a very healthy lifestyle anyways. The foods that I'm telling them to feed are in their home already, and it's a very simple transition. Basically, they're just feeding their meal to their dog now or their cat now. Whereas there's other people that come in that they don't cook for themselves, they eat a poor diet themselves, and so thinking about grocery shopping and cooking for their animal or home cooking or home making, whatever source it is that we're talking about, is just impossible. So we basically give owners a lot of options. They have options to do it themselves. They have options to order it from companies that'll do it for them. They have options to go with all of the amazing dog food brands that we know about and that we've formed relationships with, that are doing these like wonderful dehydrated, freeze-dried, fermented, all these other types that make real food really accessible for owners. And then we talk about what's realistic. And most of my clients, including myself, are doing a little bit of all of them, because we have lives and it has to be sustainable. I do work with a veterinary nutritionist who's awesome, and she's super open-minded, and I love working with her, but it is the conventional side of things. So sometimes we have to decide when we want to go rogue and do it a little bit differently and not do it complete and balanced exactly how we should, but we know that for the patient, maybe something different would be a little bit better.
Absolutely. And that could always be adjusted and moved around. And
really, and always doing blood work, always checking body weight. I'm in it for the long haul with them after we meet. We basically are with each other for the rest of the patient's life. So it's always a process of making sure that we're doing the right thing.
Absolutely. Yeah. Here's an important question, since you brought up blood work.
Oh, yeah.
For a human, obviously, okay, I feel a discomfort in my left side near my stomach. What's going on? I feel some lump here. Obviously, dogs can't say, "Hey, mom, I'm feeling a lump," or "I'm feeling something weird in my internal body." Yeah. For an animal that is, let's say, 3 years old, how do we know without imaging, without these big things that we can do, CT scans, et cetera, to know that cancer isn't growing? Yeah. It shows symptomatically. Like, I know every animal's different. Yeah. But how do we know that? Do we have to do X-ray every year? Do we have to do ultrasounds every year? What do you suggest to do as a proactive step to make sure things aren't actually happening from within that we can't see?
Exactly, because prevention is the best medicine, right? And with cancer in particular, that's one that I don't know if we'll ever cure it, in the sense that once you're diagnosed, it's gone forever and you never see it again. I do think it's realistic that we'll turn it into a chronic disease that's managed and doesn't take our lives. But prevention is the best cure for cancer, that we don't get it and we decrease the incidence and rate. Because I had mentioned this in my talk, but I'm not sure that all pet owners are aware, the rate of cancer in animals is the same as it is in people. It can be as high as 1 in 2 dogs over 10, 1 in 2 men, 1 in 3 women, 1 in 3 dogs in their lifetime, 1 in 3 cats. And so it's rampant. And so prevention is obviously the best thing that we can do. So what does that look like? Well, owners often will get very frustrated when they come in, because they'll say, "We just had blood work done 6 months ago and it was perfect. How is this happening to my pet?" And the unfortunate reality is that most cancers, unless it's a blood cancer, a liquid cancer, aren't going to show up in the blood work. So any solid tumor, masses, tumors of organs, unfortunately, they're usually not going to show up in blood work. And so I do talk to owners of seniors about doing imaging, chest X-ray and abdominal ultrasound, because it is the best way to look in the internal body cavities. Good physical exams and having good relationships with your doctors, your veterinarians that can pick up on things, having masses tested are important. And those are all conventional approaches that I think the veterinary community is pretty comfortable with. But from the holistic side of things, from a prevention standpoint, what's really important is that we are feeding good food. We are limiting our intakes of GMOs and pesticides and all those other things. We're being mindful about vaccines. We're, being cautious about the things that we're applying in our yards and the soaps that we're using. And so there are, on the human side, only 5 to 7% of cancers are genetic. Basically, you're born with a bad set of genes that are going to cause you to get cancer. The other 80 to 90% of cancers are lifestyle based. And so we don't have that kind of data on the human side, but when we have dogs and cats that have evolved with us over hundreds of years, they live in our environments, they sleep in our beds, they sleep in our homes, their microbiome is 80 to 90% exactly the same as ours. There's no reason that I would think that it's not exactly the same. And so it's all those other things that the holistic and integrative side is thinking about all the time, and naturopathic side on the human side that we do all the time that is forgotten about for conventional preventative medicine that I think is more important than all of that.
Yeah. I love that. And I one of the holistic vets that I work with up here, he does like senior, he has like a senior package of like, here's what we should be testing in a senior dog just to ensure things are still moving properly. Things are all normal on the inside because we can't see that. Yeah. And again, our animals don't have voices. So we are their voice.
And, it's for owners like you and I that, are very proactive and we're knowledgeable, so we know what to look for. There are a lot of other things we can be doing, but even for people, like think of like the elderly person that doesn't have a lot of family, or even a middle-aged person that was, not raised to be health-minded. They're in the same boat as our animals. Like they probably aren't thinking of things and they get diagnosed with cancer late and, they're in a bad position. So I think that unfortunately, even though it's scary for us as pet owners that we can't ask them, I think unfortunately the same scary things are happening on the human side.
Right.
Yeah.
Yeah, and it's crazy when you actually look into the research. It's like humans, animals, like it's right there.
They're sentinels and they teach us so much. And that's why, I really love the translational aspect of what I do. And that's why I love clinical research, because I would love to be able to show in my patients that it makes a difference so that can then make a difference for a person. And so that translational part means a lot to me. It's very personally special. But they are, if you think about the research that's done for cancer medications, cancer treatments, it's done on mice and rats. And it's done on mice and rats that are injected with tumors in a not a typical situation. Whereas we have these dogs and cats living with us, getting our diseases. They're perfect models to show exactly what else could be done. So hopefully, as time goes on, the community will start to realize that they're much better to study than, laboratory animals.
Right. With your clear passion, which I'm obsessed with.
I love
it. When you graduated from the University of Florida College of Veterinary Medicine.
Yeah.
How soon after graduation did you say, I want to get boarded in veterinary oncology? Like, because I looked on your information and you went directly into your residency the year after graduation in 2012.
Yep. Yep. Right. 2011. Yeah. Yep. And then my residency 2000.
Did you have a personal cancer case from an animal that you were like, okay, that's my main focus? Because sometimes it takes time for vets to realize what they want to specialize in.
Yeah.
What was that aha moment?
I'd love to tell it. So I always knew I was going to be a veterinarian. And I think most vets will tell you that there was just like something in you always that was given to you by the universe that you were going to do this. So I always knew I was going to be a vet. So going to vet school was never a decision. It just was. And in college, as I was applying for veterinary school, my father was diagnosed with stage 4 cancer. And he unfortunately only fought for about 8 months, and he died 8 months later after a long, very painful struggle with chemotherapy and surgery. And he just had a terrible quality of life. And I remember, and it's still very vivid in my mind, there was one day where he was in the kitchen and he could come home from his chemotherapy treatment and he was feeling terribly. And my little Pomeranian, who I still have, he turned 15 in May. He was like, 2 at that time. He came into the kitchen, like looking for something, and like scritched his butt up against my dad's leg. And my dad just reached down and scritched his butt, and he got this big smile on his face. And like all the pain that he was feeling that day was wiped away. And in that moment, I knew that that's what I had to do. And so while I was in vet school, so that was a few years before vet school, fast forward to my second year, I start getting chest pains in the curriculum. And because I'm stressed, right? Go to the conventional doctors, ask them what's going on. They do a bunch of tests. They prescribe me my Xanax, and I take it, and I fall asleep. Studying for my tests. So at the same time at Florida, there was an acupuncture wet lab that was going on. And I go to the wet lab, and the dog's super zen, super relaxed, super chilled, getting his needles. And I'm like, I wonder if this could help my chest pains. And so sure enough, I went online. There's all this evidence about how it helps chest pain, angina. And within my first treatment, it was gone. And as long as I went back, it went away. And that kind of was like the peak of everything coming together. So like this passion that I had for making a difference, I knew I was never going to be a medical doctor, but I had to bring it back to the human side, because the quality of life my father had and the way that he suffered is just too typical, and it's too common. And he didn't live his last months of his life. And then that in combination with me realizing that there was this whole other area, because once acupuncture is kind of like, we call it the gateway drug, like once you get in the rabbit hole. So then once you realize that there's all these other things that marry beautifully with oncology to provide a better quality of life, which then that better quality of life means you live longer, which sometimes even means you stay in remission. It was so much bigger than I realized. Like I had an opportunity maybe 3 years ago where someone asked me the same question, for me to like turn around and look back at how it all came together. And you have this like, aha, so I really feel like despite all the things that happened, like everybody has, you're put on a journey to have certain things happen to you to lead you where you come. So I think that it all was very deliberate, and I just feel very grateful that at this early in my career, it's become so clear to me what my purpose is, because now I have the rest of my career to make a difference doing it.
And it's so crazy. Like you've learned so much in these last years, and now you're right. You have your entire career ahead of you.
Yeah.
Not only learn more, but use what you learned from the beginning and use that throughout your entire path.
Yeah.
And that's how we all need to remember to live life, is take every moment and memory and activity and experience and treasure it and use it to your ability. And that can translate positively into your animals.
Oh my gosh. Yeah.
When we're happy and healthy, we pass that on directly to our animals.
Yeah, absolutely. Yeah.
Amazing.
And, I think that, and I'm sure Gregori better than anybody who's a healer and in this community, they've had an experience like I have. They had something transformational happen to them that led them on their path that they're serving. And, I just am really grateful for it.
Amazing. So you are located, your clinic is located in Red Bank, New Jersey, for those interested.
Yeah.
How does someone come to your office? Do they have to get referred from another veterinarian, or do they just call your office and say, hey, my dog has blah?
Absolutely. Yeah. Totally call. Yeah. Dog or cat. Exactly. I'm trying to think if I have anybody else I'm treating right now. I had a bunny a little while ago that had, he got a really bad ear infection. So he got a really bad, torticollis neck crinking basically, but I haven't had any lately. So yeah, dogs and cats mostly. Anybody can call, we can schedule. We work very closely with all the other veterinarians though. And I think sometimes people say, oh, well, can you be my main veterinarian? And that's not what I do best. I love to be a teammate on the team, and for them to have their primary care and their conventional and their specialist. And then we all work together because we're all humans. It's all the practice of medicine, and there's not any of us can know about everything. So you have each one of your doctors to work all together. And most of my patients are cancer patients, but we do probably have about 30 to 40% that don't. A lot of chronic disease patients, because we're treating the garden, the terrain, the weed can be heart disease or liver disease or kidney disease, but the terrain's always the same. And sometimes we get clients that I've known them from other cases that come in and they say, hey, what can we do to prevent this from happening? Just like what we were talking about. And I think that's where the biggest difference can come in. And so I really like those too. It's like when they're straightforward and easy, I almost don't know what to do with myself. I'm done. This is great. So they can definitely call. We're in Red Bank. This is my office. It's very relaxing and peaceful. So yeah.
Beautiful. So with your practice, is it just based on like the oncologic diseases, or do you look at other things too? Like, will you accept a patient with like chronic kidney disease and try something intravenous with them to?
Yeah. Absolutely. So we actually he was just in yesterday, he's getting IV therapy. So there's a syndrome, it happens in people as well as dogs, but there's a syndrome where when there's a liver failure that can be caused by hepatitis, cirrhosis, other underlying conditions, that it causes an amino acid deficiency because the liver is not functioning anymore. And during that amino acid deficiency, there could be really bad skin lesions, basically like crusting and scaling and painful and breaking of the paws. And you can give those amino acids that are deficient intravenously. And so we have a patient right now, that's what he has. He has cirrhosis of the liver that's failing. He developed the skin lesions. We ordered the amino acid infusions, and he comes about every 2 weeks and he gets his infusions. And he's also on a lot of oral supplements. He's on Chinese herbs. He's does foot soaks and things like that when he has flare-ups. But they are normalizing his amino acid levels. So it's amazing because it's like when you think about it, he has this fatal disease that's going to kill him, but we can give him what he's missing and it can keep him going. So yeah, it's absolutely we can.
Beautiful. Yeah. Yay. All right. So there are a few little shout outs.
Great.
On screen. I'm not sure if you can see these, but Deb Sawyer.
Bear. Hi, Deb and Bear.
And then we have, who else we got? Dorothy. What's up, Dorothy? Dorothy's been to my old store a few times.
Oh,
everyone else is just saying hi. Hi, Dr. Pope.
Hi.
Love this.
Oh, that's awesome.
Wonderful explanation. Yay. People are loving. Hug her from us.
Oh, good.
Hi. It's always fun to like pop little comments up.
Yeah.
I'm trying to listen and then I'm trying to read and trying to do everything, but right, awesome. So where can people, are you going to be speaking anywhere soon that people can find you in person? Or?
Thank you for reminding me that. I don't have any client facing, actually that's a lie. Pam posted hello, we're trying to work something out for the greater Baltimore area the first week of August. I'm doing 2 veterinary conferences, which doesn't help our clients. I'm speaking actually at the AVMA, which is the American Veterinary Medical Association, which I think is awesome because that's the largest conventional veterinary conference. So I'm excited about that. And I'm actually teaching a course in December. But other than August in Baltimore, I'm not speaking again to the public until April of next year for Healthy Dog Expo, which Janet just popped up and said, yeah, that I was there last year. So, but things always change and we always post on social, so everybody can follow on social. We post little tidbits, stuff about herbs. So you can find us there.
Totally. And I will leave links to your information below, but do you want to just give those a quick shout out? Like on Facebook, there's the page. And
totally. So all social is just Dr. Kendra Pope on Facebook, Instagram. We don't really active on Twitter, but YouTube, we do videos sometimes. And then the website's drkendrapope.com, just Dr. Kendra Pope. So everything's there. We try and share as much information as we have. And as we get more, we'll keep doing that. So absolutely.
So you just rocked this live. I love listening to you. I can just listen to you for hours and hours and hours.
Well, thank you for giving me an opportunity to talk about what I love so much because, like when you're in the daily grind and with patients every day, you're affecting that one person. But sometimes I feel like there's so much education that needs to be done. And so this is just a venue for me to do that. So thank you for asking me.
Yeah, of course. All right, guys. So we'll see you later.
Bye, guys.